why we are deficient of vitamin D3. It is largely our lifestyle. I always tell this story. So when we were cavemen, okay, our lifestyle used to be that because we used to earn our food every day. We never could used to store the food. So the man used to go out in the morning for his hunting. So naturally he has to get exposed to the sun. He used to get enough sun. And what he used to hunt? He used to hunt animals, right? Only non-vegetarian was the source of food those days. So he was getting a lot of B12. So he was getting D3 from the sun. He was getting a lot of B12 from the meat. And he used to come back before sunset because he cannot stay outside the cave because he himself will become a food for somebody. So then he comes back to the cave, and then once the sun set, there are no lights. It's pitch dark. So his melatonin used to get secreted, so he used to go to the sleep. So without any difficulty. So today what's happening? Exactly opposite is happening. So we are awake till 12 o'clock, 1 o'clock with a lot of blue light in front of us. And then we are getting up late in the morning, just straight away going to our offices. While traveling to the offices also, we are traveling in cars, buses, everything air conditioned, and we are fully covered. So those days the men used to be like half bed, and women also had a lot of those exposure. Women used to do a lot of work outside. So now the lifestyle has actually contributed to this problem to a great extent. Now that is why it's it was really a big surprise till these recent studies were conducted, that India and even Africa like continent, there is so much of vitamin D3 deficiency was seen. Okay, so this is the truth now. So we all need vitamin D3, and we all need vitamin B12. We all need iron. So these are three nutrients which are widely deficient. The large number of people who are deficient in this, in spite of so many programs and so many interventions, these deficiencies are not well controlled. So the government is also taking a lot of initiatives. A lot of products are available in the marketplace. In spite of that, the deficiency is still not getting controlled, or is not coming down well, is because the kind of supplements that we have in the marketplace are not good enough to solve this problem adequately, because there is some challenge with the formulations. Because our bodies are not made for absorbing vitamin D3 through the gut. Vitamin D3 is supposed to be getting synthesized through our skin. So when our bodies are not made for getting the vitamin D3 through the gut, and our foods also, most of our foods, Indian foods, do not contain much of the vitamin D3. So we have to take supplements. Then which kind of supplements we take? We have to take a supplement that works really. So that is where our picture, we come into the picture as a pharmaceutical company. So we understand the science, and we develop the formulations with our scientific understanding, and we put years of research behind this. By using drug delivery technologies like nanopharmaceutical technology, we make these nutrients, micronutrients. Of course, we are a pharmaceutical company. We are working in various pharmaceutical therapies also. And in our portfolio, we have these three nutrients, as Madam has correctly pointed out. All these three nutrients we are working, and vitamin D3 is one of such a product, which we would proudly claim that we have been able to commercialize this product, which is a patented product. And we hold the patent in all major countries across the globe. And we have been able to commercialize this product 6 years back. And today this product has been used by at least millions of people in the country. And okay, that's one part of the story as a company that we manufacture and we market. Then we have done so much work in terms of research and innovation in this space. Then we also feel it is our responsibility not just manufacture a product, develop and manufacture and put the product in the marketplace. We should actually really do a lot of awareness, a lot of understanding at the consumer level, at the patient level. So these are all, they cannot be even called patients. They sometimes the deficiency, they don't even know. They sometimes remain, asymptomatic also for some time, but they are deficient. But only after some time they will, land into some serious problems. So if that right intervention is, if they are aware, they are conscious of these deficiencies, how to correct these deficiencies. When they go to the doctor also, they discuss their problems. Many times they don't discuss. If today, for instance, sleep as a problem, they don't go and discuss with the doctors. Unless the doctor asks, are you getting good sleep? So not having good sleep is taken for granted. Okay, at least in my childhood, the doctors used to ask you to open your tongue and they used to check these eyes and all that. I think now that practice is not that common. So now that it's not that common. So now these are the things people used to check those days. So now we are ignoring these facts. So now we thought that we must, take this initiative and partner with, a responsible organization like FOGSI, who has got a wide reach. This is one of the biggest organization who have large number of practitioners as their members. So we thought that we should, be associated with them in, making this a reality where, we want to make India like, D positive, not D negative. Okay, we are still, a lot of our population is D negative. So I think that's one of the ad which you must have seen, one of our, I think Mahesh Babu, okay, one of the milk fortified product, they talk about D positive. But then let me tell you, I think that is also something that I want you to just give you those insights. What happens in India, the fortification of these micronutrients do not work so much because the way we use our milk and oils are different the way the Western world use. In the Western world, the people don't boil the milk. They just use them as a raw milk. And Western world, they don't use a lot of oils, for frying. So they use it in salads and all that. They take the oils like that. That is where when these oils and, the milk are fortified, it helps to a great extent. But in India, our lifestyle and our usage patterns are different. Therefore, the fortification may not help so much. Because the moment you heat them to a particular level, so what you have added there as a micronutrient, it will no longer remain because these micronutrients are very, very sensitive. Okay, they don't remain, they are heat sensitive. They will not survive there. So that's one of the challenges that we have. Though the intention of fortification is good, but there is a limitation there. So that is where I think the supplements still have to play a big role. And it's not just making good product, but it is, educating the target audience is very, very important. And that is where we come into picture. And we take pride in the fact that we are one of the pioneering company in this space, and we own this space of, we want to make sure that, in fact, when I launched this product, my vision was that every dining table, the D3 should be there. Either our product or somebody's product, so that, you need it because you are anyway not getting exposed to sun. You need that as your daily routine. Okay, that's the kind of level, it should go. But yes, it will take a lot of time, but it has to first go through the, the doctor prescription, and then, now I think the government is also considering bringing out these guidelines for fortification and all that. Definitely, we have to have a multi-pronged strategy for overcoming this.